So in this video, I'm going to discuss about one of the most tested topic on Nclex, DVT, known as deep vein thrombosis. So let's start. So DVT, what is DVT? You must be wondering, right? So DVT is a blood clot that is forms in your lower extremity, right? Usually it's happen in your one of your leg. Let's say these are my two legs. So usually it's gonna happen on one side of the leg. It's called unilateral. It could happen anywhere, but mostly it happen in your legs. So in case during your exam, if you see a question most common vein where DVT develop, then you have to select option S. It usually happen in your calf vein. If the calf vein is not in the option, then you have to choose soleal vein. Got it? Soleal vein or calf vein where DVT develop. Now let's discuss about which patient they are on risk for DVT. Which patient could develop deep vein thrombosis. So in order to understand, you have to understand the Virchow triad. Very importantly, Virchow triad. So under Virchow triad, there are three categories: stasis, hypercoagulable, and endothelial injury, known as SHE, as you can see. Stasis, hypercoagulable, and endothelial injury. So once you understand this Virchow triad, it's gonna be easy for you to understand the coming sections. So let's discuss about what patient comes under stasis. So patient, those who are bedridden, they are high chances of that they could develop blood clots. Those patients who have recently surgery and they are not mobile, they are not moving, they could develop blood clot. Those who travel long distance, like in aeroplane or in the car, because they are sitting for long hours and they are not moving, so there are high chances they could develop. Those patients who are paralyzed, they could develop the blood clot. And those patients who have a fracture and they are not moving their limbs, let's say they are fractured, they are not moving their limbs, so they could develop DVT, right? These patients come under stasis. Also pregnant woman comes under stasis because like they like to rest and they are not moving like before, right? So let's discuss about second category, hypercoagulable. Hypercoagulable, you must be wondering what is the definition and what is that meaning, right? So hypercoagulable, the definition is a blood disorder where blood form clot too easily or quickly. That's the definition. Blood form clot too easily and quickly. So which patient comes under hypercoagulable? So those patients who take oral contraceptive, or those who have dehydration or any infection, and pregnancy, or patient with cancer, or patient with IBD, irritable bowel syndrome. Those patients come under hypercoagulable category, right? So let's discuss about endothelial injury. What is that meaning? That means damage to the vein or blood vessel, right? So what patient come under in that category? So patient with a venopuncture or any IV insertion, or sepsis, trauma, or let's say if a patient has a knee surgery, right? So these days it's pretty common that doctor is using hammer or drilling machine, right? So when they use hammer or drilling machine, it's gonna damage the surrounding veins, right, with that vibration. So those patients, they are at risk for developing DVT. Another thing, smoking, obesity, that's also come under endothelial injury. So let's discuss about sign and symptoms. What are you gonna see in the patient lower extremity? So let's say this is my leg, right? This is my leg. So you will see there are two different. So let's say this has DVT and this is regular leg, right? This has DVT. So you will see uh, pain. That's the most common symptom. You will see pain there. You will see shining redness. You will see swelling. You will see lymph edema. This is gonna be swell, lymphedema, and you're gonna see asymmetrical. Asymmetrical means one is bigger than the other one. So that's the sign and symptom you will see in the patient with DVT, right? If you get the question, what is the most common symptom? Most common symptom in DVT is pain. And what is the most common sign? So sign and symptom, two different things. So sign means you will see patient has lymphedema. The leg is going to be swelled, right? Lymphedema. So sign means that you can see from your eyes, right? That is called sign. And symptom, which a patient will tell you his or her feeling, like I have pain, I have a headache, I have dizziness. That's the symptom that you cannot see, but that is described by the patient, right? So let's discuss about nursing assessment. So what nurse gonna see? So let's say this is my leg, this is my feet, right? So nurse gonna dorsiflex the feet towards the body, right? Like this. And if patient is complaining of severe pain in the calf area, that means these chances that cloth has built up. Like dorsiflex my foot like this, like back towards my body, right? It's not front, not like this, it's backwards, like dorsiflex of the ankle. And if patient complain of severe pain, that means there is a possibility that patient has build up the blood clot. And also one more thing, when the patient when by doing dorsiflexion of the ankle, if patient complain of severe pain in the calf, that's there's a possibility the blood clot has built up. And that sign, that positive sign called Homan sign, you must know about that, the positive, that sign known as Homan sign. So what are the tests that doctor can order? So first, doctor can order D-dimer blood test. So in D-dimer blood test, it's gonna be positive or neutral. If it's positive, that means that is an indication that blood clot is forming. If it's neutral, that is neutral, right? What other things doctor can order? So Doppler duplex scan, doctor can also order ultrasound, right? To see, like they're gonna scan ultrasound, they're gonna see where exactly the clot is. They can, if they can see any clot, so based on that they're gonna do treatment. So Doppler duplex ultrasound. So let's discuss about the patient is gonna be on what kind of medication. So in that situation, when patient has DVT, patient is gonna be on, first of all, patient is gonna be on heparin. When somebody is receiving heparin, what lab you have to monitor? You have to monitor APTT value, right? So if APTT value greater than 80, then or less than 60, then the patient medication needs to be adjusted. It's because if it's more than APTT value is more than 80, that means patient is on risk of bleeding. If the APTT value is less than 60, that means the patient is not getting enough medication, so they have to increase the heparin. They have to adjust the dose. So patient is going to be on heparin. Patient is going to what's the antidote for heparin? HP, right? You remember heparin protamine sulfate, right? Heparin antidote is protamine sulfate. That's the first thing. What other medication is going to be on patient? So patient also is going to be on warfarin. Warfarin also known as Coumadin. So what's the Coumadin antidote? CK, as you should know, CK, right? Coumadin antidote is vitamin K, CK, Calvin cloth, right? And if somebody is on warfarin, the lab value that patient, the nurse need to monitor is INR. Very importantly, INR. And INR value should be in between 2 to 3. You must know that. And also patient is going to be on low molecular weight heparin, known as enoxaparin or Lovinox, right? Patient is going to be on that one. And what else can we do? We can also, the doctor can insert IVC filter in vena cava. IVC filter is a small device that is inserted. So if there is any blood clot, it will trap it. So IVC filter is very important for DVT treatment. As you see, IVC filter, it's called inferior vena cava. So it will planted in inferior vena cava. So it can trap the any breakdown of blood clot, and it will prevent to travel in your lungs to prevent pulmonary embolism. So now let's discuss about nursing management and intervention. What can we do to prevent breakdown of blood clot? So first thing, you have to tell the patient, do not tell the patient or any family member, do not massage the legs. Let's say this is my legs. If somebody gonna massage the legs, so the DVT, the clot is gonna break down and is gonna travel to your lungs, which will create pulmonary embolism, right? That's the first thing. Do not massage the limb. Second thing, you tell the patient to bed rest. And third thing, what can you tell the third thing? You have to tell the patient to elevate their legs above the level of heart. Above the level of heart. So let's say this is my legs. You have to tell the patient to elevate your limb above the level of heart. You don't have to put any pillow under the knees. So tell the patient elevate their limb above the level of hearts. So that intervention you have to do for DVT. So the question is, how can we prevent DVT? So first thing, we can do mechanical prevention, and second thing is pharmacological prevention. So under mechanical, Early ambulation is very important, and as well as pneumatic compression stocking. Those are important under mechanical. And the other thing is pharmacological. As we discussed, the patient is going to be on heparin, warfarin, thrombolytic, and low molecular weight heparin. So that way we can prevent deep vein thrombosis. So that's a wrap of our deep vein thrombosis. And write down, rewatch this video one more time and write down the important notes, important points. And once you see any question on DVT, it's going to be easy for you to get your answer correct. Right? Good luck.